This Medical Minute, sponsored by Avera.
You've probably heard about kidney stones and how painful they can be, but what exactly are they?
A urologist with Avera St. Luke's in Aberdeen has the answer to that question and also some advice on how you can try to prevent them.
Now, Dr. Gasky, what exactly is a kidney stone?
Well, a kidney stone is when a hard deposit or a rock forms from minerals and salts that normally circulate in your urinary tract. Most kidney stones are made of calcium, with calcium oxalate stones being the most common. But there's a variety of different kidney stones. Stones could be made from uric acid, and we can also have stones that develop primarily in relation to infections.
When exactly would you consider going to a doctor to see something about a kidney stone?
Well, most of the time, if you have a kidney stone, you're going to develop a sudden onset of pain. It's usually up in your flank, like in your back, below your lowermost ribs. And that pain can be likened to pain as severe as labor pain. And this sudden severe pain can even radiate or travel to the front of your abdomen. Oftentimes, it's associated with vomiting and nausea or even fever. So if you have pain that is sudden and severe, and it's not relieved with something conservative like a Tylenol or Motrin or Rest or something, especially if you have a history of kidney stones, then you would need to come to the emergency room, especially if it's coupled with nausea and vomiting or any fever and chills, to suggest that you have a blockage or obstruction that might require intervention.
Preventing kidney stones, what are the best methods for that?
Right. The best way to prevent kidney stones is to drink lots of fluids and maintain good hydration. For some people, certain dietary indiscretions, excessive amounts of oxalates, which you'd find in leafy green vegetables and in teas and certain beans and beets, that can be problematic for some people. But for most people, it's increasing the amount of fluids and decreasing the amount of salt in their diet. And that salt is oftentimes hidden in a lot of the foods that we eat, especially when we eat outside of the home. And lastly, diets that are very high in animal protein can also give us a predisposition to form stones.
For more information on kidney stones and preventing them, be sure to head over to avera.org/medicalminutes.